presentation that I'm going to share with you. I do want to just reiterate that the attention to family engagement in sexual health or sexual and reproductive health is part of a comprehensive partnership program, and Riley's very good slides that talked about the general importance of good connections with families really makes that very clear, and you will see reviews of that kind of approach in this presentation that we're going to work through together now. We're really talking about how a school, a district, a state, or a district with all of its schools can develop the kinds of excellent connections that Riley was talking about in programs of partnership, and how health issues and sexual health and reproductive health and prevention of risk behaviors can be part of a full partnership program to establish all the benefits that Riley was sharing with you. So I call this presentation Then and Now, because we're going to take a look historically at what I call the old way of thinking about the full partnership programs, of which health you will see is part, and then the new way, the better way that our research studies indicate are effective, are equitable, and affect students' success in school. This work extends Riley's picture a little bit from parent engagement to school, family, and community partnerships, and you'll see how that works in a moment. And I do welcome your questions. Any questions that you have that we'll have time at the end of this discussion, we will cover and talk about with everyone. If you have other questions, you're more than welcome to contact me at my email address, which you'll see later on as well. So this is a conversation and a development of capacity that we're really interested in helping you, all of you who are here today, at the state, district, and school levels, build your abilities to establish and sustain excellent partnership programs with the help of your grant. That will be really exciting. And then if we do a really good job, should the grant end or when the grant is completed, you will be able to conduct these programs effectively and throughout your state, throughout your districts, and in your schools. That's the goal. It's a long-term goal, but we see success across the country, and I'm hoping you will extend that, scale it up so that we see success in your area. So let's go through our story. It's a kind of a story or history, and I'm going to ask Lacey to double check because I'm not quite able to send this forward.
Try that now.
Let's try. I was able.
Try one more time.
Okay.
Yep.
All right, here we go. So we want to start where I think all of you are starting from, and I actually use the term healthy schools and successful students to characterize the whole school picture or the whole school program. Whoops. So what do we mean by a healthy school? First, we mean a safe and nurturing place. I'm a sociologist, and I don't like you to hold that against me, but we think in terms of location, of a place, of an environment, and what we mean by that in terms of partnerships is this is a welcoming school environment for everybody. I call it a partnership school. In the textbook that Riley showed you a picture of for teacher training, we talk about a family-like school and a school-like family. By that we mean a school that treats children the way a parent would, meaning parents treat children knowing that they're all valuable and interesting and worth our time and trouble, and they're individual. They have talents and skills to build and develop. And a good school is going to treat youngsters in that individual, personal way. A school-like family is one where the parents treat their son or daughter the way a teacher would, meaning they're sending messages that school is important, that homework must get done, that attendance is important, to be in school every day on time, and reinforcing the importance of education. Really all we mean is an excellent school that everyone wants to attend. And I think we all take this kind of for granted, that this is what we're trying to build when we say school improvement or school efforts and so on. You may have some other ideas about a safe and nurturing school, but these days that is not enough for a successful school or successful students. All of you at the state, district, and school level know that you're really required to have schools that produce results for students. And we know that your school improvement plans, your targeted goals, your mission statements cover many, many different kinds of outcomes. Schools are responsible for building academic goals and results for students, and we say all students. Even though we know these are challenging goals, they are the goals of every school. There are state standards now that are guiding these. Everyone is following graduation rates, reducing dropout rates. Sometimes we forget that that means a promotion at each grade level. And people are talking of college and career readiness, pretty much the same way we talked about reading and math readiness for kindergarten. So there are academic results of importance that every school is working toward, but within our school improvement plans or our standards, academic results are not enough. Our schools are working toward the physical health and good nutrition, exercise, prevention of our risk behaviors, the sexual education that you are focused on in this particular grant, that also refers to or affects good attendance. So physical health is part of the agenda of the results that schools are working on. And even that's not enough, because mental health outcomes are also part of school responsibilities. We pay attention to student attitudes about school, the positive behaviors. You saw a note of anti-bullying kinds of goals that schools have not only set, but they're working very hard to make sure that those goals are attained. And of course, good relationships. We've just started to work on successful transitions between preschool to elementary, elementary to middle, middle to high school, and high school to post-secondary something. So this is all part of the agenda that is really keeping everybody busy. Teachers are very, very busy and committed to working on these many goals for student success. And in your state, your district, your schools, you may even have more. So you can see that the health outcomes are part of the picture of what schools work on, and they work very hard across this country to try to do their best for students. There's always room for improvement, and you know that in your own improvement plans. So what does this all really mean in terms of what we are going to be working toward today in this discussion? And we know that studies confirm, as Riley also mentioned, that when students are involved, when parents or other family partners are involved in students' education, there are positive results for students. And she mentioned some of these, and these are really those that we do have research and confirmed studies, more than one study, in terms of the health-related kinds of outcomes. Good partnerships with families and their children in middle and high schools lead to higher and better attendance, achievement results, good behavior, higher graduation rates at the school level. We have had studies of students' eating habits and good exercise, and studies of risk behaviors. As Riley mentioned, good partnership programs help produce these positive results. At the school level, we do have studies that show good partnership programs create safer schools and better health services, often for students and for their families, as well as for the community in general. We call all of these results the results of good partnership programs. And we know that we're all really trying to attain the best we can for students. We have underlying all of our work a theoretical model that I call overlapping spheres of influence. We ask, where do children learn and grow through the high school grades? At school, at home, and in the community. And what we've learned is as we overlap these spheres of influence that help students learn and develop, then we can have partnerships that create more successful students. We also know that out in the real world, and possibly among your colleagues, certainly not those who are spending time on this day with us, but we have people who say, if the family would just do its job, then we, the schools, would be able to do our job. There are things that families do on their own, and there are things that schools do on their own. These are separate spheres of influence. And what we find is in terms of schooling, when we separate the school, family, and community completely, then students really don't know which messages are most important for them and for their education. Whereas our overlapping spheres theory, which has been tested and proven over and again, says that students do better in school when home, school, and community connect and when they partner. So this is the picture that underlies all the work we do, because we're trying to understand what happens in those areas of overlap where we see the overlapping spheres. In our own work, when we were first studying kindergarten, preschool, elementary school, there's quite a bit of overlap. The spheres of influence grow closer together. When we first started high school studies, we saw high schools where the spheres of influence hardly touched because they had not built partnership programs. Now in our network, the National Network of Partnership Schools, we see that by taking new directions, middle and high schools can build strong, age-appropriate, goal-linked partnership programs that have important overlapping spheres of influence and that affect student success in school. That's what we're hoping all of you will want to work on. So what are we talking about today? What's important to know? Not only that this is an important topic, which you all really do know, and not only what is needed for a good partnership program, and I'm sure you have many good ideas that you already see working in your schools, but really how to organize successful, equitable, high-quality partnership programs that involve every student's family in ways that help students do their best in school. It's the how-to that our work in the National Network of Partnership Schools is working to support every state, district, and school that really is ready to take these approaches. Our job is to help you become the experts in your area so that you can really build these programs in ways that are effective and equitable. What we learned is we really have to think a little new about the leadership and partnerships for these programs. So historically, this then and now story is going to show you some of the old ways of thinking and some of the new ways of thinking. In the old days, we called this parent involvement or parental involvement, and we still do because it's such an easy term to say. but we mean school, family, and community partnerships. And we mean that because the new term of partnerships includes involvement, engagement, democratic participation, shared leadership, and the shared responsibilities of homeschool and community for student success in school. So the newer term is much more encompassing, and we can get away from arguing about the language we use, which is more important, involvement or engagement. They're all part of good partnerships. Our handbook is called School, Family, Community Partnerships, Your Handbook for Action. You'll see that later. And the textbook for college courses has the same, same first name, School, Family, and Community Partnerships, Preparing Educators and Improving Schools, so that we begin to see the broad picture of a partnership program. The responsibility has changed. In the old days, whether you got involved was sort of up to the parents or organized by a few, an active parent here or there. The new way is that school, family, and community partnerships are part of school organization. It's a component of a well-organized school. And what we learned early on was that the structure of an action team for partnerships at the school level really helps make sure that a program is planned, grows, improves, and is sustained from year to year. So the action team for partnerships you'll hear and see is very important. Here are a couple of pictures of some of our recent award winners. The National Network identifies awards for schools and also, by the way, for districts, states, and organizations that show they can take the new directions and the research-based approaches and make it work in their location. And here you see elementary, middle, and high schools in the South, in the West, and in the Northeast. So locations all across the country are finding the guidelines that we're talking about today are very helpful to them. These are action teams. They're of different nature, different sizes. The one thing that's common about all of them is, if you look at them carefully, they all have happy faces. They're all glad to work on outreach to all students' families. What does the action team look like? We ask that schools have at least, and you could see in those photos many have more than this minimum, but at least 2 or 3 teachers, 2 or 3 parents or family members. The principal must be on the team because otherwise nothing's going to happen at the school level. And then many schools add others from the community, the nurse, the counselor, representatives from their parent organization. And at the school level, we require 1 to 2 high school students because they really inform the adults on a team about what is reasonable and potentially acceptable to all the students in the school. What does the team actually do is a good question. We start with the school improvement plan so that what happens with family and community partnerships is going to support what teachers work on with their youngsters. So the team reviews the school improvement plan and from it selects 2 academic goals, perhaps literacy and math, maybe science, maybe technology. Each school gets to choose which goals they want family engagement to grow and help students do better or to maintain excellence in schools. 1 non-academic goal, and that could be the focus of your program. It could be a health goal. And we do have schools that choose health as the 3rd choice of school goals. And then we really ask every school that joins our network to have 1 goal for having a welcoming school climate. These choices become, you will see, the pages of an action plan that is written by the team so that we involve families and the community in ways that contribute to the selected goals, whatever they are. Each school is a little different, and it differs across school level, preschool, elementary, middle, and high. The team also is responsible for implementing and evaluating the program. You'll see evaluation has been missing from many programs of partnership. The National Network of Partnership Schools wants to emphasize the importance of assessment, and when schools, districts, states join the network, we actually conduct an evaluation every year for them as part of member service. And then the most important is to continually improve plans, programs, practices, and results. We are not talking about an event. We're not talking about one thing that might happen well. We're talking about building a component of good school organization with the help of a team so that over time a school, a district, a state grows its capacity to work with all students' families better and better in ways that matter for student success. The structure for the team says we know schools have a school council or a school improvement team that really guides the development or approval of a school improvement plan. But this overarching group is not the implementers of partnership programs for all families. We need an action arm, and that's what we call the action team, that's going to select those 2 academic goals that I mentioned, free to vary, a non-academic goal that could be health in your project, and then the goal for an overall partnership program where we have a welcoming school for everyone in attendance so that people want to be partners and will get involved in the reading, math, behavior, or health activities that are planned as part of the program. In the old days, this all was incidental or off to the side. Now we know that there's a framework of 6 types of involvement. This work can be goal-oriented, linked to specifics in the school improvement plan, as you just saw, and part of a comprehensive school improvement program, so that family engagement is not on the back burner, away from the real improvement of schools, but is a necessary component of improving reading or improving math and so forth. So in the network, we guide you to use the framework of 6 types of involvement which enable parents and community partners to get involved in different ways and in different places. We're just running through these in this little short presentation today, but you will be able to see many, many, many good examples on our website of all 6 types of involvement that are helping schools build the program as we're outlining it today. And you'll see the web address at the end of this presentation. So the 6 types, some of you may be familiar with, are parenting, helping schools help families understand child and adolescent development, and helping educators understand their families. We hold that as rule 1, know your families, so that when you're trying to build a partnership program, you're really addressing the families who are sending their children to your particular schools in your district, in your state. Because every place is a little different, this really, type 1 is a very important underlying theme. Type 2 is communicating. All schools communicate, but not everyone has good 2-way communications where school programs and children's progress are shared with parents, and parents have opportunities to ask questions, give ideas, express concerns, and so forth. This is improving these days because of social media and the use of email and Facebooks and other kinds of 2-way connections that are making some of these communications easier. Type 3 is volunteering. And here we know that volunteers can help a school, help a classroom, but we also want to stretch your understanding of volunteers who can assist at home and stretch it even further to have volunteers who are your audience partners in sports activities, drama productions, your band or orchestra concerts, the choirs presentations. People who give their time throughout the school year as audience can be counted as volunteers. Type 4 is learning at home, which has to do with connections on homework. Riley mentioned you can have homework that is linked to health questions because parents don't have to come into school to interact with their children at home on homework activities and conversations, or at the high school level on course choices and other kinds of connections with the curriculum. Type 5 is about decision making on school committees, or in terms of rules and regulations that affect children. Everyone can be engaged, not just the active few, and that's what a good comprehensive partnership program will make sure happens over time. Finally, collaboration with the community, very important on health issues and on all parts of the partnership plan and program, where different groups, not just business partners, but faith-based communities and health groups and senior citizens and many other governmental agencies, colleges and universities, all enrich school programs, extend children's learning opportunities, internships at the high school level, and services to families. So the 6 types of involvement really help us systematize our plans for partnerships and let us categorize things we already are doing. Most schools do many of these things already. They just haven't put them into a system where they know exactly what's going on and how they want to improve their program over time. Each of these types of involvement has challenges to solve, and educators know that if you solve one challenge, another one will pop up right behind it. So we know that a challenge to reaching all families is going to be an ongoing kind of attention-getting constraint or challenge for any school that's building a partnership program to reach all families. The good part is that schools are beginning to address these challenges, and up to all families, in fact, can be a part of their children's education. In the old days, we called these barriers, and you'll still hear people say, what are the barriers to parent involvement? What they mean is, what do we do to engage diverse families, different backgrounds, linguistic backgrounds, different cultural backgrounds? People used to consider these things really barriers to preventing or limiting family involvement. We know that schools have migratory families, some homeless families. Many have very many mobile families. This was part of a process called the deficit model. People would sort of point their fingers at the parents who they thought could not, would not, or did not want to be involved in their children's education. What we learned early on in our studies was that these were not really barriers as much as they were realities. Schools across this country serve diverse families just about everywhere, and what our schools and districts and states in the network are working at and sharing with each other are what are the solutions to engaging the families who had been under-involved before, so that we are actually aware that every family has strengths, and if we have good design of activities and are thinking of preventing problems, we can really get pretty creative. And you'll see a book that we do every year in the network called Promising Partnership Practices, in which the schools, districts, states, organizations in the network get to share and show their best practices. Just about all of them have diverse socioeconomic groups, diverse cultural and linguistic groups. It's really quite remarkable how creative and how inspiring schools can be as they work on these programs. In the old days, these were preschool programs of parent involvement. Now we know these are all grade levels and all groups within a sense of community, kind of an integrated program that can include those special projects like your project on preventing HIV and STD kinds of in kinds of the programs and the notion of doing this really well as part of school organization. We do say that we build a sense of community when we engage all families, and that's really very important. Equally important, in the old days, these were school-by-school decisions. Now we know that these are multi-level leadership activities. Schools have roles to play. District leaders have roles to play. State offices have roles to play. And organizations like the APA, like NNPS, really help to kind of guide and hopefully inspire the development of really good programs so that we can really meet the official policies on family involvement, family engagement, and partnerships. Just about every state, every district, every school we work with has a policy statement, a set of priorities, or a set of recommendations that say we should work better with our students' families. When something is a policy on the books, we believe it should be implemented. And the way we implement best is in what I call a nested network. The state helps, the districts guide and recognize and reward good work in their schools. The schools share their best practices, and we have then a multi-level leadership line. The way that looks at the state, district, and organization level is we call this the double arrow of responsibilities. On the top half of the arrow are things that you all already do in your offices to be leaders for engaging families in health or in general. And so we know that at the leadership level, people are busy. They have their offices, they do their work, they have their job descriptions. What we try to help you extend in the national network and in the work that we write about is the bottom half of the arrow, where you facilitate each school's action team for partnerships so that each school is building its capacity to work with its own students' families. When we have the double arrow, these are a couple of our district and organization partners who've won awards for taking research and making it work in the Northwest or in South Carolina. It still has to fit your location, but you can show that you can do the leadership level activities and help every school build its connections to families in a better way. That's what we're hoping you will be interested in building in your partnership programs. And we'd love to see every one of the partners in the APA project to become award winners over the next 2 to 3 years. Why do we do this work? Why are you interested in this work? Really, it's to reach results for students, whether it's health outcomes, academic outcomes, or whatever. We don't do this just to do involvement activities for involvement's sake, and we don't do it anymore just for parents. In the old days, this was about the parent outcomes. In the new way of thinking, this is about student achievement and success. That includes health success. And so in the programs we develop, we're not just focusing on counting parents who come to certain meetings, but how the engagement at school, at home, and in the community link to results for students. To make sure that happens, each team writes an action plan using the 6 types of involvement that you saw, linking it to selected goals for student success, whether those are in the academic subjects, in health and other attitudes and behaviors, or in enrichment areas to create a comprehensive program of partnerships. In health, at the really at all school levels, here are some examples from our books of promising partnership programs of what schools are doing to engage families with students in physical health issues. And this includes things like workshops for parents, which can be on the topics of choice in a particular school. Once a parent group becomes aware that a school is a partnership place, then we can introduce in workshops or meetings or fairs or other kinds of entities or activities, we can introduce the more difficult topics to address that Riley was mentioning, their confidentiality problems. Before we begin to work on those, we want to create this partnership environment so that people feel safe and secure about talking with each other and addressing issues of importance. Under Type 2, schools were having newsletter activities and website sections for health tips and health topics. That's also a safe and really quite anonymous way of beginning discussions among parents or of parents with students. Under Type 3 volunteering, many schools now have either walkathons or exercise-a-thons of varied kinds, and fitness activities or invited speakers on prevention topics, often controversial topics. Interactive homework is a very safe way of helping one youngster work with their own family partner on health class topics. If there's a sex education course in the school, that's a very good way of helping the youngster talk at home on a difficult topic by having it part of a homework activity. Type 5, school health advisors, decision-making about health procedures and projects. Advisory panels and committees are part of the story. Type 6, community volunteers, health fairs, screenings, referrals, immunizations are all part of a good schools program of family engagement where an action team for partnerships is working on a goal-linked page to decide what will we do here? What's going to help our students reach the goals that we have set in our school improvement plan or in special projects like your own? And you'll see many other ideas in our books of promising practices on health and wellness. Physical health is paired with emotional and mental health, and similarly, schools may have workshops for parents on preventing bullying, and character education is a very common, popular topic. Families like to talk about these issues with their students, especially when they're guided in how to do so in an age-appropriate way. We have schools who have made videos for parents of supporting transitions at each grade level, high school requirements, and helping parents become knowledgeable partners in their children's education. Reducing violence, graffiti, safety on school buses, bike riding, and cars to schools by high school. We're wondering who's on the road, but the notion of having volunteers working to help schools, students, and families work on safety issues is quite common. Interactive homework, again, brings this home in a one-to-one way where a youngster can talk with a parent about the character education topics of interest. Health and wellness committees for school climate and mental health services in the community are also very common ways of building a partnership program with attention to students' emotional and mental health, and making sure that families and the community are seen as part of the solution rather than as part of the problem. So finally, we talk about having these programs and evaluating results. Evaluation used to be very minimal, a forgotten topic on family engagement. Now we know it's an essential topic, and we want to ensure that schools that are serious about building their partnership programs evaluate their quality, their progress, and results. As I said, the National Network actually conducts these as part of member service. But the focus is on the student success, not on only how many parents came to a meeting, because these days, in a good partnership program, a school not only has parents who come to a meeting, but also gets the information out to those who couldn't make it. And again, there are ways to build a partnership program that are quite different from just conducting an activity. And that's what we really are trying to help you think through, is the real way of reaching these goals. Networking helps. In the old days, this way, if ideas were shared locally, that was a good thing. Sometimes one school doesn't know what the school down the street is actually doing to engage families well and equitably. Now we know that we have ways to share best practices and to network to improve our programs. We actually measure networking and activity within our members and find that those who are active networkers do better in outreach to more and different families. Everything we've just talked about is about equity. We no longer point fingers at who can and cannot be involved. Rather, now we design activities that will involve all families, even if it takes a couple of tries. We're not talking about magic today. We're talking about building the capacity to run a good program. So over time, we involve more families. We meet the real requirements for speaking in languages parents understand, not just different languages, but clear English as well. And we know that if we do that and build an equitable program, then more and different families will become involved. In the old days, budgets were not well allocated. Now we know they must be applied to the goal-linked planned partnership programs. As you heard from Riley, the CDC strongly supports family engagement for student health as part of a full partnership program. In several of the CDC publications, which you will see in the handouts and in the references that I'm going to show you, the CDC has kind of a three-stage set of directions that we must connect to set up such programs, that we must engage by really working at the implementation of the 6 types of involvement, and that we have an obligation to sustain these programs, meaning to continually improve partnerships from one year to the next, so that we can get from the easy practices to the more difficult and more controversial and more complicated health issues that you are studying and improving. The reference at the CDC, one of them that Riley gave you, is also on this slide, and they're really excellent, excellent resources. So in this short time of 35 minutes that we've been chatting, I've been trying to give you a little mini course. And here are the topics we covered so far. We talked about principal leadership, the definition changing of family engagement, that we're talking about family engagement and community partnerships at all grade levels, where an action team is going to write a plan using the framework of 6 types of involvement linked to school goals for success, so that we can engage all families in an equitable way to produce results for students with budgets that make sense. And we're going to make sure that progress is evaluated, that networking occurs, and that district leadership and state leadership is really built over time. So as we leave this little discussion today, I'm asking you, when you think back on our talk together, that you look at these components, all of which we talked about in the last 25 minutes, and think about which ones, in your view, which changes from the old way to the new way, are important for your partnership programs to make them better, stronger, more equitable, and which ones are going to help family engagement in student health. At the school level, very simply, we're talking about establishing a team writing a plan, using the framework, allocating a budget, having time that the team will meet, and evaluating and improving the program from year to year. State, district, and organization leaders' responsibilities are to help all their schools do this work. Ultimately, we have to get to the school level because that's where the children are. That's where the families relate to best. We want you to know that a network helps and that at Johns Hopkins University, we're here to help you build your capacity and your strength so that you become the experts in your area for using research-based practice, for giving your schools the help they need. We provide on-call technical assistance and a whole variety of resources to our member sites. As Lacey mentioned earlier, we do have a national conference, November 5th, 6th, which your project has generously agreed to sponsor your attendance, which is really wonderful, and we will have state leadership activities as well as district and school sessions at this conference. Coordinated planning and help on evaluating your work, and the opportunity to share best practices and earn national attention in the awards that we provide. Your slides and this handout that you will be able to download show the many different kinds of publications that we offer. That first one in light green is very important, and we give that to people who join our network. It's our very comprehensive handbook with a CD that has all of our training materials right on it. We're not trying to make secrets about any of this work. We're trying to help you get to be the experts on conducting these programs, hopefully with a connection to NNPS so we can learn too. We learn from the sites we work with. And then these are from the first set I showed to you was from the publishers who printed these books, but we also produce publications here from our center, and the first one over on the left is our annual book of promising practices. You see 2014, we just sent the newest one, 2015, we sent that to the printer today, and there's another collection from sites to share their best work. So I'm going to turn this back over to Lacey, and besides we'll go through and go back to your questions, but in your slides you'll see the references to useful publications that I'm citing in this presentation, and also we call your attention to this excellent resource from CDC that Riley mentioned on promoting parent engagement in schools to prevent HIV and STDs among teens. It's a very comprehensive, very readable, small but powerful document. And we hope you will visit us at our website so that you can become a member or just use the resources that are there for everybody. So I'm going to turn this now back to Lacey, who's going to pick it up from here.
Thank you. Thank you very, very much, Dr. Epstein. That was a wonderful, thorough presentation. I'm sure that has evoked some questions. So if you have not yet written your questions into the chat box, go right ahead. If not, you can also raise your hand, and I will call you, and you can ask your question out loud. So take just a few seconds and type your questions in here, and I will read them aloud to Dr. Epstein. All right, so I'm seeing some questions coming in. I'm just going to pull them up here. So this is a question coming from Tom in Vermont, and he is asking Dr. Epstein that says, our SEA has staff that work directly with school districts to support their school improvement work. Do you think these individuals could be trained to coordinate these efforts if our state education agency cannot support a person who works full-time on school, family, and community partnerships?
A leader for partnerships at the state and sometimes at the district level does not have to be full-time, but it helps if a team or a set of leaders can work as a leadership team where from one office, an interdepartmental set of connections, among those whose stated responsibilities include connections to families, can work together to support this agenda. At the state level, the most important tasks are really outreach to districts. States get into difficulty on this topic if they try to help every school in the state. There are just too many of them. But if they are working with districts or outreaching to districts or to their intermediate units like their regional service centers or BOCES in New York or their education service centers out in Washington, there are ways for state leaders to create a leadership nested structure, even if they don't have a full-time person in their office, or if they can create a full-time equivalent of people across departments or with their intermediate units. There are different ways to do that so that it works. I have no doubt that Vermont can be helped or guided in multiple different ways from which they might choose. How do you want to organize the work in Vermont? One of the things that we're finding that you probably already know is every state is different. And so there isn't one way that we can see that Vermont is quite different from California, which is different from Nebraska, which is different from Utah. And we've seen things be organized well and work well in very different places, but the organization is going to take some different forms. I would encourage you to take Lacey's generous offer. Come to the conference, because you leave that conference in November with a plan. Whether you join NNPS or not, you still would leave with a plan and an understanding of the options and your decisions about how you want to go about this work in your location without having to do it the same way as another state. Each state is really different.
Great. I think that's hopefully a great answer. And I will talk more just at the end, but for those of you who are not aware, for our 1308 state education agency partners, APA will pay for one membership to NNPS and one registration fee for the NNPS Leadership Conference that Joyce has described. There's more information about that conference in your handouts if you want to check it out. And this offer can be used at the state level or for a priority district. And I'll talk a little bit more at the very end about what you need to do to make sure that you can take advantage of that opportunity. So I see one more question popping up here. This is from Michelle in Washington, D.C. And she said, she was just asking what topics will be covered at the NNPS conference, and will this be appropriate for the early education crowd?
All right. The conference is organized for new members or prospective members, and then for experienced members. So for new members, we have a day-long training that helps you leave the conference able to do this work with your schools. For new members, the second day of the conference, there are concurrent sessions on a variety of topics, such as involving fathers, involving multicultural families, engaging with families on homework, all kinds of important topics that have come from the requests of member sites over the years. And this year is our 20th anniversary year and 20th anniversary conference. So we've added some new topics, including state leadership on family engagement, that will be on both days so that you can really take advantage of that at the conference. If you follow the links that are in the handout that Lacey is providing for you to our website, to the conference, the whole agenda is outlined and the opportunities for concurrent sessions are listed. And so you'll see the many choices that you will have at that conference. Early childhood education is definitely part of this work, just like high schools are definitely part of the work. We have a wonderful award-winning site in Cleveland helping 40 some odd preschools. They all have teams, they all write plans, and then they take challenges each year to engage fathers or to work on STEM subjects in all kinds of ways. Each grade level has goal-linked engagement activities that are appropriate to the age of the students, the goals of the school, and the engagement of families.
Great. One more question, and then we're going to move on. This is from Sarah in New Jersey, and she asked if the center can identify districts that are current NNPS members. So
we certainly have different ways to do that if it's in your own state. What we don't do is put everyone up on there, because some places joined last week and some places joined 10 years ago. Some are very experienced and good informers, and others are still learning, just as some new members would be. In the books of promising practices, however, which you can open on the website, in the section called Success Stories, we do identify and give an email address for sites whose work is in each book of promising practices. There are 75 or so activities, every year, and they're identified of where they're from and who's the contact person. Also in that same section, Success Stories, we have our award winners whose pictures you can see. Our new award winners for 2015 are not up yet. They'll be up within the next few weeks. But and our website just changed its image, its look. We have a makeover, and that site is still a little bit under construction. But you can see districts and states from last year who were award winners that identify the folks, their stories, their locations, and so on. So if you have particular questions, either that one and the website doesn't help you, or other questions that we don't get to today, see my email on your screen right now. You can just email me your questions. Our rule is answer all questions. So I'll be glad to address any question we do not get to today.
Great. All right. Well, with that, I think it's probably time for a little stretch break here. So I've included a few desktop yoga poses that you can do here. We're almost to the end, but just want to make sure that you're all still engaged. So take just a few seconds here, and you can and get yourself nice and loose and ready for our last presenter. All right. So a few more seconds, and then I'm going to turn it over. I'm very excited that we have Ann Gilbert. Ann is the director of the Central Vermont New Directions Coalition, and she's partnering with our 1308 State Education Agency partner, Tom, in Vermont. And Ann, I'm just going to unmute you here. Are you there? Can we hear you? Are you there, Ann?
Sure. Hello?
Yes. Hi, Ann.
Oh,
yes.
Oh, good.
We can hear you. Wonderful.
Right, very good.
Thank you so much.
Well, thank you, Lacey, and this has been a really fabulous presentation. And I'm with New Directions Coalition here in Montpelier, and so many of the things that have just been discussed are things that we're helping link together in our community here as well. We are a prevention coalition that is really promoting and encouraging healthy behavior, especially among youth, and decreasing that risky behavior. And one of the ways that we're able to do this is to reach out to families and reach out to parents, and we do a lot of this by connecting through the schools. Now, where we're located right now, there are two different school districts very close by, right here in Montpelier. But we also do a lot of connecting throughout all of Washington County. We've had some funding through the Vermont Department of Health and the Agency of Education to work on a number of prevention programs. And the Partnership for Success grant that we've been working with recently has also enabled us to start this Guiding Good Choices parent education program. Now, this would never have happened or been as successful if we didn't have a real network of partnerships both in place and that we continue to cultivate. Now, the Guiding Good Choices is a parenting program. It's a 5-week program. Parents meet for about 2 hours. There are PowerPoint slides and there are video clips, and then there's time for discussion on different topics for each week, and 2 co-facilitators. We usually have from about 6 up until maybe 18 parents. You don't want a group that's too big so that enough people have a chance to talk. And the fun thing about this program is that the kids are invited to come on week 3. And the topic on that 3rd week is practicing refusal skills. So how to say no to things but still keep your friends. And one of the other powerful components of this is there's a little homework each week, and that's holding a family meeting. So it's really practicing communication, having different topics to talk about each week, and then the parents do start holding a family meeting. At first, it turns out to be, it starts out being, let's plan some family fun. So there's no pressure. But as the course progresses, the parents are talking a little bit more about setting clear guidelines, really having to think as partners or as a single parent about what their views are on alcohol use and drug use and curfews and their expectations about schoolwork. And so there's a lot of communication that happens over the course of the 5 weeks. And the partners that are involved in this, you know, we got training and materials from the Vermont Agency of Education and then the Center for Health and Learning and the Recreation Department here in town, as well as the schools. They donated the space to hold the classes. We had a parent group that donated the money so that we could hire childcare to enable a lot of these parents to attend. The editor of the local newspaper invited us to be guests on his TV interview so that we could promote the class, and we put the information on our website. We sent announcements out through e-newsletters and through guidance counselors and nurses at all of the schools. So there was quite a network of communication going on. And the way we really kicked it off was we helped promote a parent education presentation that was already taking place at one of the high schools. And we brought flyers about this there. And there were so many parents who were already attending something else and looking for the next thing to go to. And so they were able to pick up our flyer and sign up for the class right away. And we've even had some parents attend one class and then their spouse attend the next one that came along. And it's been a lot of word of mouth. Parents are talking about it and networking. There's so much practice that takes place in the class of parents reaching out and doing some icebreakers and starting to talk to other parents in the class, which is really good practice for them in the community and in the schools to start meeting parents that they didn't know before, especially because this class is geared toward parents of kids in grades 4 through 9. So we're really trying to target those kids who are going through that transition into middle school or into high school. And this is actually a time when sometimes parents are getting less involved in their kids' lives or in their kids' school. Maybe they've been very involved at the elementary level, but you know, there's a little bit more independence for the students at the middle school level, and they haven't really found their place in the school. And so we're trying to keep that connection open and support the parent groups and any kind of parent education.
Great, Anne. Thank you so much. I think that's just a really wonderful example of how you have implemented many of the strategies that Dr. Epstein described. I really appreciate you joining us today. We have time for just a few more questions. If anyone has a question for Anne, a question for Riley from earlier, or for anything that Dr. Epstein talked about today. So you can go ahead and type your questions in or raise your hand, and I'm happy to make sure that those get directed to the appropriate presenter. Any final questions, please just type them in, or any comments or any inspiring ideas you want to share, welcome to. Give everyone just a few more seconds here. I'm not seeing any questions. Don't be shy if you have something you want to ask our presenters, and you can absolutely contact any of us at the end. I'll make sure to share once again our contact information. But if there's a pressing question you have right now, this is your chance. All right. Well, I'm not seeing any questions. So we're going to go ahead and kind of wrap up our presentation today. I just want to summarize a few of the resources that have been talked about. There's been some really fantastic resources shared with all of our presenters, and so there's the links to those resources. I am going to be following up with a resource sheet that will include all of these links and some additional resources for you. And I will also share the slides from the presentation today. And when we have the recording available, I will also make that available on our Safe and Supportive Schools Project website. So I just want to recap what we've talked about today, revisit our goals. We were really trying to give you the why, the how, and leave you with some sense of now what. We really hope that you feel more confident in being able to explain why engaging parents in schools is so important for establishing safe and supportive school environments and for overall HIV/STD prevention among adolescents. I hope that you have at least found a few resources, whether you downloaded them in the handouts or something that you plan to follow up with when I share the resources after today's webinar, that will really help you increase your parent engagement, whether you're at the school level, the district, or the state level. And finally, I hope you're at least thinking about one specific action step that you want to take to improve programs and practices of school, family, and community partnerships in this upcoming 2015-2016 school year. If you are a school district that's on this webinar, you may want to share your action steps with your 1308 State Education Agency Coordinator just to see how they may be able to support you in implementing those action steps and how APA may be a part of that as well. In terms of next steps, when you conclude and leave this webinar, an evaluation is going to pop up. Please take the 5 to 10 minutes to complete this webinar or this evaluation of the webinar. I would really, really like to hear any additional information that would be helpful to you and get your honest feedback about the webinar. Watch for my email with the additional resources, and please share those with your networks. And lastly, consider joining the National Network for Partnership Schools. If you heard something today that really resonated with you that you think would help your school or your district or your state education agency, and consider attending the NNPS Leadership Conference. As I said earlier, for our 1308 State Education Agency partners, APA will pay for one membership to NNPS and one registration fee for the Leadership Conference. And that could be used at the state level, or if you have a priority district that maybe wants to pilot this in your state and see how it works. Please email me by September 30th if you plan to take advantage of this opportunity, and I'll share my email if you don't already have it. And lastly, I just ask that as you're going out and doing this work, just think about the successful ways that you're partnering with families in the community and share them. I would love to promote your work on the Safe and Supportive Schools website and share this work with other partners. If you become a member of NNPS, I hope, as Dr. Epstein stated, that your examples would be part of the promising partnership practices. And please just email me directly if you have examples of things that you would like to share or ideas. My email is here, as well as some more information about APA and our Safe and Supportive Schools website. I want to give a special thank you to Ann Gilbert, to Dr. Joyce Epstein, and to Riley Steiner, and everyone for attending today's webinar, Engaging Parents in Schools to Promote Student Health. If you have any questions, please feel free to contact me, and please take the survey right as it pops up at the end of our webinar. Really, really appreciate you doing that today. When the webinar recording is available, I will email you a link to view that webinar. On behalf of the American Psychological Association Safe and Supportive Schools Project, thank you very much, and I hope you have a great rest of the day. Bye-bye, everyone.